Okay, so Jerry, how did you come to work with John and the Better Health Advisors team, and what made this partnership really come to life?
Thanks, Hannah. I just want to say, first of all, I'm over the moon to be sharing John Samuels and his team of Better Health Advisors work today. This has been one of the greatest finds that I've had in my long professional career as an entrepreneur, as a CEO. And so I'm just super excited to share their magic with everybody else. The way that I met John Samuels through our good friend, Lewis Schiff, who runs a program called Birthing a Giant. He brought John to come in and tell us about this very concierge. The way that I did it at the time was like, when you're having a health crisis, you're terrible at being your own advocate. You're in a crisis. You don't know everything that they know about the healthcare system. You don't know how to navigate it. But even if you did, you're in a crisis. You just can't think clearly or straight or know how to advocate for yourself and navigate the entire system. In the United States, we have an incredibly complex healthcare system. If you find yourself in the ER or just any other dire circumstance, this is no time to try to figure it out and be a pro at navigating it. And so when he was saying all that, it was really speaking to me, because I just think that resonates. I think everybody knows in those moments, you're lost, you're scared, you got a whole lot of adrenaline running through you. If you're the one that's sick, that's terrifying, and you want somebody else to just kind of offload it on. He was speaking to a bunch of entrepreneurs, CEOs like myself, people that are fairly privileged in life and might be able to have this. It's a very high-end service. It's a very high touch. They're sparing no expense to make sure that they have the best experts on their team in every category that you might have an issue to help you out. So it's a very a high-end service. And I didn't move on it. I didn't think about it for a number of years. And then I had some issues with some family members, like multiple things just popped up at once. And I thought, okay, I'm going to call John, see what he can help my family members out with. I checked in with Lewis right before. I said, hey, this guy, John, you still like him? Nothing happened. Then made you not like him. And he said, I remember clearly, he said, his team works hard for the money. And he goes, they earn it fully through and through, and I have no issue endorsing them. I have found that to be 100% true. So we engage with them. They're really amazing at solving our problems. John has a woman named Barbara on his team. I remember my wife said everybody needs a Barbara in her life. And I thought that was really that's just a really strong endorsement. But I couldn't stop thinking about, I'm one of these people that is always agitated that, and understands the mechanics of business, but I'm agitated that certain things are available for the CEO, for example. And so hearing my wife say, everybody deserves this in my life, automatically made me think that I wish our employees in our workforce had this kind of thing, and how much would change, how much stress is encompassed with health issues, so much stress and so much finance. That can often be, the spend on their team often offsets itself by what's alleviated, and wondered how could we get this available to all of our people. My general thinking on benefits, I know everyone has benefits for recruiting or what is even the cost of benefits. My overall kind of always when I'm thinking about benefits, I'm thinking about what are things that individuals cannot get a tax efficiency for that employers can, and what are things that are better bought in aggregate as a group than individually. And so, naturally, healthcare is something that we think about when we think of it. It's probably the first employee benefit that we think about. And let's just be honest, healthcare in America it sucks. It's terrible. And it feels like the lowest thing you could do for your employees is offer, United Healthcare, Aetna, Blue Cross, whatever the heck standard health insurance is. That is the lowest standard of care. And one of the things I always want to get across to our employees is that they matter more to us than just their contribution to the job. And tending to somebody's health is the absolute best way to show that. I'm often trying to explain to people in the recruiting process that they're not widgets to us. And we might not be the top dollar on salary, might be 10% less, but you're not going to be treated just like a widget And this benefit right here has been the best way, I think, of all the things that we have to show people that we care about them more than just a widget. And I think that that is the workforce of the future and where things are going. And I think that's what people will really start to get on board with. So that's really the background.
So Jerry is the CEO of a remote software company. How did you think about bringing BetterHealth into the suite of benefits that you offer as an employer? How has it sort of fit in and complemented the more traditional insurance offerings that more people are familiar with?
Yeah, so I mean, just starting off, picking your insurer is complicated for remote teams. And John's team at BetterHealth has incredible wealth at just helping us even select who is going to be our, they get to know our whole team, what's going on with people, what's going on with their families, the states and localities that they're in, so that they can say, hey, listen, I think you need this insurer, or even then looking at the plans that are available and helping us select which plans. So when we were doing our plan selection last time, John's team got on and said, they asked a whole lot more questions than I would ever as a CEO be qualified to ask, as far as just being able to select, and then helped us make sure we had the plan options that we needed, knowing what's going on. They've done full background on 70%. Any of our workforce that's been spent the time to give them full background and knowing, listen, these are some of the things you have going on in the areas you're in. I really think you're going to need these things, or you need these other add-ons, or you don't, and you can save some money here. But it's just difficult as a remote workforce. And so having somebody that even help us make that selection, I just normally feel like I'm flying blind. And in this case, I felt like I had like the top pros with me to help us decide.
Great. And could you speak to some maybe specific use cases as far as emergent versus routine care that has helped your team?
Yes. I'm very, Hannah, as our chief of staff, she knows like the timing of things really well. Like, hey, today's a good day for you to maybe kind of throw this comment out or remind people. I found that just sort of constantly reminding people about this benefit can be the most timely thing in the world. People are struggling with things that they're not always sharing, that they don't know how to navigate. And sometimes it can just be this reminder. We say, just a reminder, we have this incredible service, and here's the number, here's who to call if you need to navigate it. And usually when I do that, somebody else who has utilized BetterHealth Advisors suddenly just chimes in and talks about, oh, hey, I didn't tell everybody, but they were a lifesaver with this issue that I had. And what I find is that's what makes people kind of jump in and pick up the phone, call and say, listen, we're having a lot of mental health. I think mental health is something that's, it's underreported. It's definitely ramped up through the pandemic. I think, it was exacerbated through the pandemic. But it never, mental health doesn't always feel acute to people. And I've actually found that going the mental health route with his team has then creates this familiarity with them when they're having a very physical problem, that they call and they feel comfortable and they know, hey, I need to talk to you. But the thing that we actually remind everybody to do as a baseline is say, just call their service, get your whole background to them so they can make sure that you have the right medical team in place for you and your family as kind of a foundational layer. And so sometimes people come in through a very, I'm in a dire need. And sometimes people are a little more proactive and just call up and say, okay, this is everything going on with myself and my family, all of our needs. I've had a number of people on the team, sometimes they don't want to tell me everything that's going on with their health. Just say, listen, all I did was call and double check that my team was the best. And they said, I think you could use a change in a couple areas. And that change led them to a new doctor. That new doctor immediately made some change in their healthcare. That was, the words that they used were life-changing. One employee said, best I've ever felt in my whole life. That meant a lot to me, to hear.
And I'll echo some of those thoughts. Jerry and I, as Jerry is the CEO and myself as chief of staff, we are kind of looped in often when there's a crisis happening with one of our employees and their health or their family's health. And BetterHealth really serves as the first line of defense when employees are still in that triage state, whether they're in the emergency room or they're figuring out what the next step is for themselves or their family member. And it's really just a good routine kind of known path when there's an emergency situation that could be, you know, rising stress, anxiety for the employees. So we really appreciate having John and his team on speed dial, so to speak, for those kinds of situations.
I have employees, I get slacks all the time saying, this is an amazing service. And I basically remind them and say, you know, this kind of service is not normally available to, you know, this broadly. And we just didn't think it should be. And I'm so glad that John's team has created this new offering. I think it's going to be a revolutionary benefit for companies. There's what you were just saying, Hannah, reminded me of the like nothing we really want employees to feel like we have their back and build trust. We feel like people do their best work when there's trust between employer and employee. And I think this has been one of those ways where it's kind of like, show me. And you get to see like, we've got your back, and you build some trust, especially when it's an acute thing, because you can say like, guys, don't worry about work right now. Tend to your health, and here's some people to help you tend to your health.
Mm-hmm. It's definitely the default response that we have when there's a scary situation. It's, have you looped in BetterHealth? We talked to John. So we appreciate that support. So John, I want to ask you, as really an expert in this space, there's so much complexity in healthcare today, especially recently with the pandemic. So what would you say is the most complex aspect of healthcare today, and how is BetterHealth Advisors supporting employers and employees in navigating that?
Thanks, Hannah, and thanks, Jerry, for your kind comments about BetterHealth Advisors. It's really a pleasure to work with you and the team at Atlas Op. We're really enjoying the work that we're doing for your folks. Healthcare was very complicated before COVID. Healthcare has lots of treatment options, from urgent care to telemedicine to ERs, and the loss of primary care, having a point person where most patients don't have a primary care sufficient for them, insurance intricacies, competing interests from insurance companies, the hospital systems and doctors, and lots of people fighting over money. That sort of made health insurance and health care very, very complicated before COVID hit. And then when COVID hit, we suddenly had an urgency for knowing what's going on medically. The changing nature of the virus was confusing. Staffing shortages was brutal to get care. New delivery models, all of a sudden people are getting treated through telemedicine, and hospitals weren't able to get ready for that. Medical records weren't able to support telemed and billing and charging and what's going on clinically. And then of course the mental health crisis that we've always had, but was exaggerated during COVID. So healthcare was incredibly complicated and just got really very, very much more difficult from a patient care perspective during COVID.
I'll add just real quick too, that in the early days of COVID, you know, now we all know about it, know what to do if you get COVID and all these things. So the early days of COVID, we did not know. It was very scary. You did not know anybody yet that had it or had died from it. And then it started happening. And just having, like, telling our people, like, if you get COVID, call John's team, call BetterHealth, was really, really nice. I'll say also that John's team really helped my family take advantage of the fact that nobody was seeing very hard to get specialists during COVID, and it was during the pandemic. It was an excellent time. You could get in with the top specialist that you needed because people weren't doing it. And just like, this is how you stay safe and go see a doctor, and we could really get you in the best people during this time. And that was a huge, like, I just didn't know that. I didn't know that there was something we could take advantage of. And then just I wanted to add, John said the mental health that got exacerbated during this time, which also led to substance abuse for a lot of people. You know, there's been a lot of substance abuse that followed the mental health issue that followed that. And, you know, just seeing like the wide variety of things his team can handle is impressive. And I was thinking like they would have a partner for, you know, this, that. They really got it all covered.
Right, absolutely. And I think that's intentional on the part of the Better Health Advisors team as far as building that emotional connection with employees. John, do you want to speak a little bit about how you build that trust and have that sort of silver lining of a Better Health Advisor, you know, supporting an employee during a stressful time? And how do you kind of think about that relationship?
Yeah, thank you. We get to know our clients, right? We understand who you are. We understand what's happening medically. We do a thorough health assessment to get a sense of what's happening, physical health, what's happening, mental health, and really understand who our clients are and what their needs are. At the same time, we look at what their health insurance is. We look at who their existing medical team is so that we can get them the custom treatment and care that they need. So if somebody is in, you know, is in Virginia and they're having a hard time finding a psychiatrist or psychologist or something, we're familiar with their health insurance plan. We know who they are. And then because of the wide tentacles our team has, we're able to connect our clients to the right providers for them and help guide them on the way to getting the right care and treatment.
We've heard some of our employees compare you all to sort of a quarterback on a football team, the quarterback of their healthcare, and looping in all the different providers that have all different specialties and just making sure that all the dots are connected and that, you know, they're not facing it alone. So I think that's definitely felt by our team.
You know, a lot of what we do is we fill in the gaps. So our team, our senior nurse practitioners, our social workers, our counselors, we know what the providers on the other side are looking for. We know what questions they're going to ask. We know what information they need. We know what key medical information to relay to them to make them successful. And we also then get back to our clients and talk to them about what's going on medically in plain English. So we are the real liaison there between what we know what the providers and treatment teams are looking for, and we also know what's going on emotionally so that we're able to help support the individuals who we're working with.
I think one of the things that I pull out of that personally is I don't always know what questions to ask, or I should have asked, or what records I was supposed to get, or, you know, like those are all the things that John's team is just gonna like, no, you need to ask this. I'll ask if you don't want to ask because it's uncomfortable, hand them the phone, you know. And I'm like, that's such a I really don't like grilling my doctors. I don't know why. I just don't. I know people, it's their persona, and John's team's like, if you need to, like, take the phone to the doctor and we'll ask the tough questions and we'll make sure that the records that are needed are transferred. And like, was this just an insurance decision, or, you know, for $500 more, could you have had another thing that would have been way worth it? Or sometimes those things that you're not presented with all the options always.
And Jerry, when an employee of yours has a crisis, it's a crisis to them, and their ability to think through and act and behave in a way that's going to be conducive to them is much more difficult. For us, it's an urgency, but it's not a crisis. So we're able to plan and prepare and organize and do that. One of the very first employees you sent us was on the way to the hospital, and we sent them a list of questions to ask. We checked insurance while they were going to do it. We were talking to the primary care doctor, connecting to the care. We were talking about what the care will look like once they leave the hospital. So we're able to think through what's going on and help plan and prepare them for what they're in the middle of.
Yeah. You know, I'm reminded of, I have this saying that doesn't always land well on people, but it's that weddings are optional, funerals are mandatory. And it's just like, you know, like, it's optional to be there for people in the brightest moments of their life. It's mandatory to show up in the dark, lonely, scared moments of their life. And, you know, to me, this is just one of those, like, one way to do that. It's like people really remember when they were scared and there was help. You know, they may not remember it, like, oh, did you come to my wedding or not? You know, there was a bunch of people there. I can't remember. I was overwhelmed and kind of thing. Sure.
one of the things that we've done specifically to help your employees is that, we recognize, and I guess you're recognizing as well, that just getting somebody health insurance and good health insurance as you do isn't enough to get people good care. So it's only good if it's utilized effectively. So the work that we can often do is help find an employee the right primary care doctor for them, or get someone a treatment program that fits them and negotiate the price, or get doctors to talk to each other. And I've worked in large companies. I've ran large ERs. I ran 17 ERs before I started this company. And as an employee, when I was an employee in a large hospital system, we can tell if the leadership cares about us or doesn't care about us, and providing a service to them where they're able to better utilize their health insurance with the support and assurance that they get from us. We can really tell that you care a lot about your employees.
Mhm. That means a lot. That means a lot to both of us. I think the only way to get your employees to care about you is to care about them, and you can't fake it. And there is a standard of care that I think is accepted when you offer somebody employment, that is just sort of a requisite standard of care of ownership that you're taking to look out. And I know that's not everybody's philosophy on it, but I just think I think that the 20 years ago, or maybe even a decade ago, people led by leverage. They led by having leverage over people, and the internet is one of the things that has made it more difficult to have leverage over people, because information could be shared and people could outmaneuver leverage. And the model of leadership that works forward is leading by inspiration. And, I think it's a two-way thing, and that I'm very inspired by a lot of our employees. And so I feel the responsibility of trying to inspire them too. And I just see this as one of those ways. I see that you do that with your team as well. So thank you for that.
Yeah, thank you.
We had one of our, sorry, I just want to say one of our employees wrote up a very, it was very transparent. It was I was shocked at how much detail of his own medical journey, some health issues that he had put together. But he just said he really wanted everybody in our company to know how useful this service is, and he didn't feel he could deliver it without kind of really giving some of his own information up. But for this audience, I would just keep it very high level and say he was in a very dire situation for a couple of years. A nightmare would be the word that I think is appropriate. And he worked step in step with your team to get to a solution. And then the end of that solution was a very, somewhat of a radical, needed to make decision, not radical, but it's an aggressive decision to have to make, an impatient decision and a very expensive decision. And what really, I think there at the end made the difference is this is one of those things you don't want to do twice. You don't want to do 3 times. And so it can be difficult to look through something that, say, $20,000 solution and say a $40,000, like what is the difference? Is one actually that much better than the other? And I remember him just going into that decision and saying that he had a lot of confidence that he was making the best decision that he could, not to have to do this 2 or 3 times. We kind of joked about do it nice or do it twice kind of mentality. And this is a health thing, it's not a house or a home project. You want to do it right. And that was a revolutionary upgrade for his revolution is not the right word, but for his family. And he just was like, I don't know if this is going to work, but we know we've got at least the best information we can. This is worth a shot. And fortunately for him, it did work. And that's not, his vulnerability to do so sort of drew out a lot of other people bringing their stories because they saw how much it helped too. And so, I mean, I've been moved to tears multiple times just reading our Slack thread. We had people that just thought like, I'm not sure I'm going to be able to work, and they got in with somebody that was able to heal them and get them working again.
Jared, you don't, that story with your employee who, one where the sort of aggressive decision was made for treatment. You don't want to do it twice. You also don't want to do it alone.
Yeah.
Right. And we were with them every step along the way. And that's what
All the way through it, like all the way through it.
100%. Yep. Yeah.
And there were moments in the middle where I'm aware that it was, I don't know if we made the right decision. And I think you guys' guidance about how these things normally go helped them, okay, stay the course and get out on the other side of it.
Yeah.
Which is, I think they needed to hear that bad from people who had more familiarity. I mean, this is not the kind of thing you normally go through, but if you're dealing with a multitude of clients and you have, and also there was a decision there made to go outside of insurance.
Yeah.
And it was the right decision too,
Yeah.
which can be difficult to navigate as well.
Yeah. And especially in this space that, you're referring, and there's less, there's wide variation in quality. There's really wide. You're not just walking into CVS and picking up, generic Tylenol. There's wide variation, and it's shocking for me to see such, but that's why we really, we're really glad that they took advice that we gave them and are doing well.
Something that comes to mind too is that one of the stories that stood out to me that made me think to reach out to you in the first place was that somebody had been told they had to have a leg amputated, and they reached out to you, and turned out through the work you were doing, they didn't have to have that leg amputated, and you were able to save that leg more or less, and not quite as severe, but we've had a couple of other circumstances in the company where, kind of close to that, and could have been, very different circumstances for, I would just say, their mobility. And mobility is such a key factor of your health. And when I just look back at like, man, you never know, we're just saying, getting the right information to a person and advocating for yourself or discussing with a doctor can change for somebody. So that's a big deal. That was the thing that made me hire you for myself.
And that person you're referring to with the leg amputation, the hospital who recommended that procedure is known as the top hospital, one of the top hospitals in the world for care and treatment. And we moved him elsewhere, got another opinion, and got an opinion that was less aggressive, less invasive, saved his leg, and saved his ambulation for the next 10 years. So yeah.
That's amazing.
Gonna call time. We're 37 minutes in.
Okay.
This is flowing as we knew it would. Other topics you want to make sure we touch on?
I think we got a lot. I don't know.
Yeah.
What do you all think?
John, I'm just curious. I mean, you were in very traditional healthcare management before.
Yep.
What was the need that you saw, and what spurred your transition into more of an advisory kind of consulting model?
So I had a family friend of mine called and wanted help with her husband who had dementia, and they were very involved in clinical trials, spending a lot of money on clinical trials for treatment for him, and very invested in that. And they asked me to do some research into the treatment that they were getting. And I did that and came out with the fact that what they're doing is really meaningless. Better off just exercising, and gave them that advice, and in turn saved them a lot of money. And then we switched their medical providers to other doctors, and did some work for her to get her set up medically. She needed a primary care physician and to change insurances. And then she told me her friends want to hire me because they need help as well. And then I realized that there's a pretty large gap in the market between people really needing help around advice and guidance around care and treatment.
Great. Calling time again. This is something that you might have gotten some inbound questions on, and we don't need to, share a recorded answer necessarily, but wanted to give you the opportunity to, is just sort of the interstate complexities of women's reproductive health care these days, and how you all are helping to navigate the changes we've had in the last few months.
So off the record, I haven't been asked to get involved in any of those cases, any case as such just yet. But if I were, I would do the best I can for the individual in front of me.
Other specific topics.
I don't know if you can be off the record on this too, but John and I have talked about, we've talked about the treatment care of African-American, specifically women, but I think African-Americans in general, my wife being an African-American woman, and just having somebody in your corner to advocate for you and make sure you're getting the best treatment. I think my wife, it makes a difference for her. She says, she's like, I don't know that I've ever experienced substandard care based on my race and sex, but I'm just aware of the stats and knowing like your radar can sometimes go off and just go like, yeah, this feels like one of those times where I might be being ignored. And so she's like, just the number in my back pocket makes me feel really comfortable that if I feel like I'm not being heard for any reason, like who knows why, any reason, like I've got this number in my back pocket where I can make sure that like I have this team in my pocket I can run things through. And I just, I appreciate that aspect of it too, especially as I know, we have several employees whose families also fall into those categories, and it agitates the hell out of me to think that they wouldn't get the same healthcare from a hospital or a doctor, that, especially an emergency, that they would. And so I've kind of reminded them of that, like, if you feel like you're being ignored or you're not heard or your own advocacy isn't there, like call them in and let them help figure out like how to navigate and what to do instead. Do we need it somewhere else?
I think there's a natural tendency for providers and people in front of other individuals to behave in a way more professionally if there's someone standing over them who's been in healthcare for a long time, who understands how healthcare works, and who is really knowledgeable about the way treatment works, so that we rarely have to escalate what's going on medically to senior leadership and things like that, but we know how to do it, and we get stuff done so our clients get the care that they need. Right on. John, I'll say too, I don't know if you remember saying this to me many months ago when I met you, but you said something that really resonated with me about your character, that I just thought was another reason I eventually reached out and called you. I was asking for kind of circumstances about specifically how high net worth individuals access your service. And I was asking questions like if you go to the hospital and, wait times, all these things. And what you said was something along the lines of, listen, if you're in need of care urgently now, and the hospital is not, giving it to you, we will do everything we can to make sure you get it. If you just don't have time, like if you just think your time matters more than everybody else's in the ER, and you want me to fast track you through the system because you just don't want to wait that long, I don't do that. Because that means somebody else who might need the urgent care isn't getting it. And you were so clear about, I don't do that. And I don't do that for my clients, no matter like how high net worth they are. I do it for them if they need it, but not just because they don't want to sit in the ER. And I just, that punctuated for me my understanding of your character, and was a huge piece of why I wanted you to be part of what we're doing at Atlas Up in our benefits package. So you might not have known that, but I thought it was worth mentioning. Thank you. Yeah.
Hey, John, talk a little bit about how you translate the jargon that often, makes people terribly insecure because they don't understand what's being said.
Yeah.
Anyways, you're able to, bring it back to layman's terms. Talk about
Yeah.
that.
So a lot of the work that our nurse practitioners and counselors do is talk to the medical team. And then once that happens, be able to sometimes sort of sitting at a doctor's visit with the patient, physically there or there on the phone and saying to the doctor or to a provider, time out, let's talk about this. Let's discuss exactly what's going on so that we can really understand what's going on medically. It happened when I was with a client of ours years ago. We just said, time out to the doctor. She kept saying he's bad, he's terrible. We slowed him down, got him more information, and then she was able to understand what's going on medically. So sometimes it's, really spending more time, paying more attention to what's going on so that our clients have more information about their care and treatment. We have to recognize that the provider in front of you has boundaries to what they could be doing, meaning they have a certain amount of time, they have certain number of people they should refer you to. They can only refer to these programs within their system, and so forth. And regulations say that they can't say certain things and so forth. We work outside of those boundaries. So there's other things we can say, there's other research we can give, other tools we have, and other ways of talking to our clients about what's going on medically so they get more information, which then in turn gives them more support.
That's really useful. I've experienced that myself firsthand.
Mhm.
With the team.
Talking about equity in healthcare, that can sometimes be an inadvertent way to make it clear that the patient and the doctor are not on the same playing field necessarily. And it's really wonderful that you all help to level that and get everyone speaking the same language and prevent any sort of misunderstanding or any dynamics from happening there.
Yeah, I mean, I think it's a pretty powerful thing if a nurse practitioner who's worked in healthcare for 20 years or a counselor who's worked in the ER for 25 years is sitting with a patient, with an employee of yours, client of ours, or talking to a doctor saying, this is what's going on and so forth. I'm their health advisor. I'm their health advocate. Explain what's going on so we can make sure we're doing the right care and treatment. That gesture, that checking, that person there who also says to your employee, if you forget some details, don't worry, we got this. If you forget to ask a question, don't worry, we'll do it. Don't write everything down, we have it. So, and then this says to the doctor, everything you're saying that needs to be done, we'll make sure they do it. I was in my own ER when I ran an ER and I broke my wrist. And the doctor, who was a friend of mine, told me 24 things to do for discharge instructions: ice, heat, see this physical therapist, raise it this way, move your arm this way, take this med at this time, don't take it with this med, with this food. 20 things. I remembered 8 of them and did 4. And that's one person in one place with one simple thing, right? So let alone somebody who has lots of complex things going on medically. Having a person with you who can help do that eases the burden and also helps compliance.
Mm-hmm. And speaking about, confidentiality and compliance and things like that, how do you think about sort of the patient or the employee and your relationship and being an advocate for them, but also respecting kind of patient-provider confidentiality and HIPAA and, what the employee might not necessarily want to share entirely with their employer?
Yeah, great question. All of our clients sign a HIPAA waiver, allowing us to look at medical information. We look at that for the purposes of talking to the rest of the medical team. We look at that so we can educate and inform other providers and relay key medical information. Information does not go back to employers, families, or anybody else, insurance companies, for what's going on medically. We follow strict HIPAA guidelines that we only talk to those we need to, that we get authorization to in the medical community.
The another thing that sort of impressed me was I had my general practitioner had said I needed to get some spots on my face checked out, and immediate, thought was I need to get the best dermatologist on the planet because, usually like that. And I talked to John's team and said, yeah, I need like the top dermatologist. And he said, well, the top dermatologist is going to be really tough to get into. You need to get into a dermatologist faster than not. And they found, I forget what it is, but it's like, there's a really high end office, and the number 2 person there, what is like an assistant or something like that? I don't know. Is just get in with them. And because this is a basic scan, anybody can do that, has the equipment and the training. And then if there's anything questionable, they'll pull in this really high end person. You can't get in with the high end person, they're not taking new patients, but the kind of second person there you can get in with, and they'll know when they need to get the top person at their practice to come look at you real quick. And that's exactly what happened. I ended up having like 4 spots that were precancerous on my face that had been unattended to because I was waiting for the best person. Could have been pretty dire. And I just thought it was great to kind of push me off my natural habit. Well, no, I just got to wait until I get the best, and it's worth waiting for.
What's interesting is that there's a few principles that we follow in this work that we do. One of them is just that, right? If we can get you in somewhere and we know it's a good practice, then we can escalate to somebody more senior because we know how practices run. Another principle that we have is if we can't get you in, if the soonest appointment is in 3 weeks, we'll take that appointment and then we'll call them to try to get it done sooner. But we always grab them, any appointment we can get at someone we're trying to get appointment with. Another principle we have in the work that we do is if we want to find out what's going on medically, even if someone's changing doctors, we'll call a previous doctor and say, you were the previous doctor. We still want to talk to you about what would happen. Help us write these gap transition medications or whatever and move forward. So there's a handful of principles like that that we follow that really help our clients.
That's helpful.
I want to give a special shout out to the education that you all do as well. In our inboxes, our team really enjoys reading the write-ups that you all do, really bite-sized information, but every topic from how to prevent long COVID to how to prepare for a long hospital stay, just really helpful tips and tricks that you kind of have on a really routine basis, not even our team reaching out to you. It's just sort of there as an added benefit. So we appreciate the education that you're always giving to up-level us.
Great.
Yeah, they're very topical, timely kind of things that tend to be in people's mind. Like the headline always grabs people to, oh, what's this, another junk? Oh, no, you're like, wait, no, I want to read this. It's just something important. So job well.
Thank you.
Job well done there. Well, thanks, guys. I don't know if we had anything else we wanted to cover, but I just, I just feel strongly that people need to know about this offering that you guys have built, both for individuals and also for companies. And I know that I'm going to be taking this video and putting it into a lot of the different my peer CEO entrepreneur groups so that they can see and hear about this. I'll put it on my social, but also just in some like Slack and Facebook groups that I'm in, because I just think a lot of my peers would really be advantaged here.
I appreciate that. It's really a pleasure to work with you both and your team at Atlas Up. It's really a wonderful relationship. So thank you.
I had no idea this was going to be a love fest. This is great. Thank you.
That's what we decided to do.
Hannah, do you plan to edit this into bite-sized pieces? Is that the idea? Just take some sound bites?
Question. So our
You can go ahead and stop the recording. So
yeah, let me go ahead and stop this.
Yeah.
We will actually just share you all on the full recording.